Equity, through its energy pillar, has partnered with learning institutions and hospitals to install clean cooking solutions.
When we were celebrating our 35 years anniversary as Equity Group, we decided to plant 35 million trees. We realized majority of the schools were using wood fuel for cooking in their kitchens. 1 million metric tons of wood every year worth 10 billion shillings. Our 35 million trees would be at risk. And as a result, we did research and realized with 5 billion shillings, we could be able to transform all our schools to use LPG or whichever other form of clean energy they would prefer.
30,000 schools, both primary and secondary, still be using wood to cook. His Excellency the President is very clear that he wants forest cover to be over 10% by 2030. That's in less than 7 years' time. This is something that will make the President happy for several reasons. But the most important one, that you will save money which the government wants to use for other things. But more importantly, you will save trees.
This initiative has seen hospitals like Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu benefit from a liquefied petroleum gas bulk installation.
What informed Equity was the observation of and discussion between them and us on the inefficiency of energy utilization. Particularly at that time we were using wood. The inefficiency of energy utilization and also the inherent pollution that this was bringing to the environment. And we learned that Equity as a group, an Equity Foundation, had more than just the banking branch. It also had programs for environment, it had programs for energy. And so we said, hey, why can't we take advantage of that? And we found that whatever they were quoting for us in terms of the assistance on the energy platform was very affordable and used less money for the cooking because we were very surprised that they said that the stoves that we had were actually good. They would only upgrade them the way they are.
The hospital, that has been in existence for over a century, has mainly used firewood as a source of fuel. The upgrade to LPG will see a complete overhaul of the hospital's kitchen and cooking facilities.
Hii gas mnatuletea itatumanufaa kwa sababu 10 years down the line, tangu nikuje hapa, tunatumia makaa na hiyo inatufanya tuko na magonjwa mbalimbali. Mimi niko na kifua kikuu juu ya hii makaa ya hapa. Cha pili, itafanya chakula iende kwa time. Kwa sababu tukitumia makaa, makundi saa zingine zinakuja kama ziko mbichi, inafanya tunachelewesha wagonjwa na chakula. Hii jikoni si modern kitchen, ni jikoni ilitengezwa zamani. Kwa hivyo mvua ikinyesha, ile moshi inakutana na maji, inafanya zinashikana. Kwa hivyo moshi haizipita. Na hii inatuletea wafanyikazi wetu ugonjwa. Moshi haipiti juu haitoki nje, sasa iko tu kwa jikoni.
There is that need of conversion into clean fuel so that we can work hand in hand with the government initiative of 10% forest cover. And you'll realize that we cannot really achieve that 10% forest cover if we continue cutting down on trees. And the major consumer of these trees that we cut down are institutions. That is why we are here at Jaramogi Oginga Odinga, to see to it that we convert their kitchen to use clean fuel. We are going to change the whole kitchen system from using firewood and charcoal to start using LPG or liquefied petroleum gas. We are also doing renovation, giving this kitchen a facelift by painting the whole interior and exterior walls. We are also fitting new tiles on the wall and polishing the floor. So we want the kitchen to be as clean as it can be.
Jaramogi Hospital serves county, sub-county and private hospitals in more than 10 counties in the Western Kenya region with a population of more than 5 million people.
So it is a great asset to the region and also helps to train and improve care at the sub-county hospitals which are basically peripheral facilities.
And being a referral hospital, they had a vision of ensuring before the year 2020-2021 ends, they must have achieved their parastatal level due to the services they offer. This is one of the key areas that was affecting them in terms of their scorecard, because their kitchen was not aligned to that level of upgrade of being a level 6 hospital or a parastatal.
The installation by Chev Energy will ensure that soot and teary eyes will be a thing of the past. It will reduce the cost of cooking and workload on the kitchen staff while giving a better aesthetic look for the hospital.
In terms of saving, first of all, in construction, somebody had given a quote of 15 million. So with what we are going to pay, our savings in construction of refurbishing the kitchen is in the tune of 12 million shillings. Yeah, that is massive. But in terms of recurrent costs, we would be saving on a monthly basis about $500,000.
We normally get gas from Mombasa. After that, we come to our plant. We offload, we put it to the big tank of 25 tons. After that, we start filling from 3 kg, 6 kg, 13 kg, 50 kg, 1 ton, 1.5, and 2 tons. Equity Bank, it has really helped us from the scratch up to where we are now. Normally, we go to the schools, hospitals, and anywhere. If they don't have money, we request them to borrow from the equity, and then they can pay, and when we can continue with the work.
The new LPG refilling system is automated, ensuring the hospital cannot run out of cooking gas unexpectedly.
We are fitting a 2-ton cylinder. This 2-ton cylinder, like for instance, in each and every patient per day will be consuming 0.03 kilos of gas. So for the 2 tons, it is going to run for around 168 days. According to the technology that we are fitting here, we will fit a gadget that will be transmitting to our system on a daily basis on the consumption of LPG. So there is no point in time whereby the institution is going to run out of gas. Yeah, because each and every day we will be having that data, so we can promptly arrange for a refill in case the tank reaches 30%. What we are also going to fit, we are going also to fit a gas leak detector, whereby in case there is a gas leakage, there is an automatic shutdown, so that it cannot be hazardous to the environment.
Chakula ikipikwa na kuni obvious, ladha yake haitakuwa vile inafaa, kwa sababu zingine moshi kama imekutana na ile chakula umepika, watu watakuwa wakisema tu ni mbaya, yani haiko to that level inafaa iwe. But kipikwa na gas, ile ladha yote wagonjwa watapata itakuwa palatable pia to the eye, na pia sisi wapishi kama wapishi wa hiyo hospitali, at least tutajulikana tunapika chakula vizuri kwa wagonjwa wetu.
The partnership between the Level 5 hospital and Equity extends beyond clean cooking solutions to providing support in its healthcare service.
The fight against COVID also depended on mitigation of COVID activities, which was incorporating continuous use of masks, hand washing, sanitization, and keeping distance. Equity Foundation became a huge partner because all along Equity donated sanitizers for the people to use in the hospitals, what they generally refers to as PPEs.
Estimates from the World Bank suggest that LPG stoves are 40% more efficient than firewood stoves, with LPG flames burning hotter than the latter.